Well, good afternoon, everyone. Welcome to this session of the 2024 Culture of Data Conference. We're so excited that you're joining us. My name is Ann Hill. My pronouns are she, her, hers, AF, and I will be moderating this session. We are also joined by Taylor Bostick, and her pronouns are she, her, hers. She will be managing the Zoom and making sure that the tech is running smoothly. You're all currently muted right now, but if you do have a question during the Q&A session, which is at the end of the presentation, please feel free at that point to unmute. You're also welcome to incorporate or provide any questions or comments in the chat if you need anything, or if it's during the Q&A session as well. If you're comfortable doing so, we do ask that you please add your pronouns to your Zoom name. And you can do so by clicking on the three dots in your video square and then selecting rename. For this particular session, we just have one presentation, and it's going to last about 25 minutes. And then afterwards, we'll have a question and answer for about 10 minutes or so. I'm really excited to welcome our presenters, Meredith Warman and George Ottoby, and they are working on the iHeard Colorado project. The iHeard Colorado project gathers and distributes community-level data and health information in near real time to help advance health equity and health outcomes. And without further ado, I will now turn it over to Meredith and George to present the presentation, iHeard Colorado, Leveraging Community Voices to Understand and Rapidly Disseminate Health Information. Meredith and George, it's all yours.
Great, thank you. Can you all see the first slide? Okay, thank you. So, hi, my name is Meredith Warman, and I am with the University of Colorado, Department of Family Medicine. I'm here with my colleague, you can see me pointing, George Ottoby. George, do you want to do a brief introduction?
Yes, I'm George Ottoby. I'm with the iHeard, and we'll be sharing the information that we gained during this last few months in regards to the impact we're making, and look forward to sharing the information with you all.
Thank you. So, I guess my things don't work. Okay. So iHeard Colorado is part of the larger CEAL Colorado CEAL convening. What is, oh my gosh. I'm totally blanking now on CEAL, Community Engagement Alliance Against Health Disparities. And we are funded by NIH. And this acknowledgement slide, we're acknowledging that we do not have any conflicts of interest, and these are our own views. Today, we were going to go over just iHeard Colorado, kind of a broad overview, and then dig into like how we go through the survey process and data and sharing, which is George's forte. And George is what we call trusted local messenger, trusted messenger, and they're really our key in dissemination. So in a nutshell, we were funded for a pilot project starting February 1st of 2023, and that actually ran for 1 year through the end of February of this year. We were given additional funds to go until the end of September, but this presentation is focused on our activities and processes for that first pilot year because we have made a few changes since then. As I mentioned, we're funded by NIH. This is a rapid, almost real-time gathering of weekly surveys from community members from across Colorado. And within 3 days, results are analyzed and redistributed out to communities. Surveys focus on health information throughout the nation and also at times locally to Colorado. And then results and the true information, because we do collect data about misinformation, false information, that is then shared with community members. We use our trusted community connectors and our trusted local messengers who are trusted community members who really have their communications and trust with folks in the community that might otherwise not be heard. that have health disparities, and we really want to leverage those voices. And then, as I mentioned, I'll go into detail about the weekly survey process. Our partners are iHeard St. Louis. They are also a CEAL funded community, and they are the ones that actually started iHeard. This has been their CEAL focus. And then we added on last year as a pilot to their expansion. We also work with Colorado State University with their Institute for Research and Social Sciences, or IRIS, and they are actually our partners who help us distribute the surveys. And then the Trailhead Institute, and during our pilot phase, they helped do the weekly incentives for survey participants, as well as help with all the contracting and payments for our community connectors and trusted messengers. So as I mentioned, our key participants, we had 3 community connectors. These are folks who are already engaged in the Colorado CEAL project. They're well connected to their communities, have trusted relationships, are seen as leaders. And so we worked with them to recruit survey panelists intentionally, and also to recruit the trusted messengers, knowing who do the communities really trust, and who do they go to for information. So we worked with folks from Pueblo, the San Luis Valley, and the Metro Denver area. I have a map in the next slide. And then our trusted messengers, we had 18 across the 3 regions. And so they were really charged with sharing the weekly results and the health information with their networks. Then we have survey panel participants. We had recruited and enrolled about 130 community members to be taking the weekly surveys. And I'll go into recruitment and who we were recruiting in the next slide. And everybody, including from community connectors, trusted messengers, and the panelists, all received compensation for their time. So here's a map of where we drew from. So you can see the Denver Metro, Pueblo, and San Luis Valley. We were really intentional in wanting to amplify the voices of folks who might not otherwise be heard and who experience health inequities, which is also the main focus of our CEAL work as well. So we wanted to bring the trusted factual health information to these groups. So for our pilot phase, we wanted to find community members who were 18 years and older, spoke English, lived or worked in a participating county or community, identified as Latina, Hispanic, Chicana, or Mexicana. And we have to have access to either email or smartphone with internet, because that is the way the surveys were distributed. I can go into further detail in a bit. And recruitment was conducted in person by the community connectors or via email. And they were very intentional. We actually had a cross-check process to make sure that everyone who was recruited was actually intentionally recruited by those community connectors. One reason being we didn't want bots taking surveys or anything, but we really wanted to make sure we were reaching the audience with this work, just because it was a pilot. So enrollment, as I mentioned, the community connectors would reach out to potential survey panelists. Some of them would actually sit down and do the recruitment survey with them. That was a Qualtrics survey. So you could do that either on your phone or just go, if you're on a computer, you could do that. But this was all electronic, no hard copies. Once someone was deemed eligible based off of the eligibility criteria, and we did the cross-check that yes, that person was actually intentionally recruited, they would be sent a baseline survey. The baseline survey included information about demographics, use of social media, COVID, vaccine information, and as well as like, where do you get who do you listen to for health information and trust in government and other sources. And then upon the completion of the baseline survey, our partners at Trailhead would mail a reloadable Visa gift card. And that was loaded then every week when people would take surveys, we would reload that with $5. And as of February, we had 130 community members enrolled as panelists. We had recruited about 180, but not everybody took the enrollment or took the baseline to be officially enrolled. So as we mentioned previously, this is a rapid process. So the survey would go out via either email or text message all through Qualtrics on Saturdays at noon. People, if you did not respond, you get another notification Sunday and then notification Monday. The survey closed noon on Monday. And then within a couple of days, once we knew who took the survey, they would get the $5 loaded onto their cards. Also, I do want to back up and share, we as the project team and the community connectors had the opportunity each week to add local questions, and this local to Colorado, local to regions, local to our priority Latina population. So we could really try to dig more into what are people truly hearing on the ground and get at questions and concerns that could be more relevant to our community. For example, St. Louis might have certain questions related to what's going on in St. Louis and Colorado. One question we had was about plague in some of the farm animals in Colorado. So, or not farm animals, critters. So we were able to get an even more localized take on what information was being circulated. So after that survey closed, within a day, St. Louis, their team would analyze the survey data. The following day, they would publish information to our iHeard Colorado dashboard that they manage, St. Louis manages, which I have a screenshot in the next slide. Also, they would work to develop social media assets, flyers, a weekly newsletter, e-newsletter, which we call the weekly alerts. I also have a sample of that. And by Thursday, we could get all of that information out the door to the trusted messengers and folks who are subscribed to our weekly newsletter, get that all out the door for them to start reviewing and sharing. So I will share some, I don't know how well you can see this, but if you go to the website, the co.iheard.org, that's our dashboard, and that also has links to our newsletter if you're interested in signing up for weekly alerts, which I highly encourage you to do. So this data dashboard, it's I'm losing the word, but a dynamic dashboard. And so you can click on different things like response and data and the response. So for example, if in this example, it says DNA fragments in the vaccine change your DNA, you could actually click on response and it would say, some people might think this, but here is what you should say if you hear this comment. And so it actually gives a very easy, understandable, bite-sized blurb that folks could then share with their friends or participants in a group or things like that. And so the dashboard would help show what the data were from that week's survey, if people were thinking it was true, and the response. Similarly, our weekly alert or e-newsletter has information about what was gathered in the survey and the factual information about it. And we also, so St. Louis does the main template for the wording, and then we can add in local comments, local data, local resources. So that was nice to be able to localize that. I also want to bring your attention at the top. These images were intentionally designed by our team. So we have the mountains representing San Luis Valley and Colorado in general. We have the cash register building representing the Denver metro area. We have the Pueblo River Walk. And I do want to give a shout out to my colleague, Allison Lee, who is the one who actually designed all of these by hand. It was quite impressive. So these were the colors and the images were very intentional to speak to our audience. These e-newsletters, the intended audience was more at an organizational level or more at our trusted messenger focus so that way they can choose what information is most appropriate for their audience as they are sharing the information either by social media, where at the bottom you can see view shareable materials, as well as flyers. So next, I will hand this over to George. Oh, you were muted.
Sorry about that. Appreciate this opportunity to present to the group. Very excited what this organization has done. What I am is a trusted messenger, and we are individuals from our communities that we serve. I come from Southern Colorado, native to Pueblo. Very strong cultural and linguistic ties. My family has been here. We were the first Mexican families to settle here in Pueblo, Colorado. And Spanish is my second language. What we try to do is reach for messages, communities, and organizations. We try to get the word out to what's going on. Our backgrounds and experience with familiar generations, social justice issues, determines the health and empowers us to make positive impact. We also share information that is essential and needed to the community, not just messaging. We range in age, demographic areas, Denver. I'm from Pueblo in the San Luis Valley. Using technologies to share the information like Facebook, Instagram, and X, that was normally known as Twitter, emails, and texting. Some of us use handouts to facilitate discussions. Every Friday, I have a meeting with my voter registration people, and we meet. And one of the things we talk about is what's going on in our community with health issues. So know that I have handouts that I'll facilitate during the discussion so I can share it with our people. This is vital for us to have this information out there. This is some of the iHeard posters that we were putting out. These posters, we would get them probably on a Wednesday, and then we would start giving them out to the community so that they would have something to start working with. And the things we would look at was not only posting them. I have at least 5 Facebook pages and email of at least close to 100 people. But out of that 100, only about 35 or 40 are health-related individuals. But using the Facebook and using the materials for the email helps me to get the information out to the community, share these posters that already exist. I don't have to build a poster. They're very simple. They're very easy to read. And we're able to get those out on Thursday, because we'll get it on Wednesday. We'll get them out by Thursday. I'll post on Friday and Saturday on Facebook. Like I said, I have at least 8 to 10 Facebook pages, Chicano studies, veterans, personal. I have several books I have out there on health issues. So I'll add these onto them. Plus the organizations like the American GI Forum and LULAC. Those are other organizations that I'll share the information with. If not over the video or over iHeard, I will attend their meetings and I will hand out information to them. We tag other people depending on the information. Again, it's kind of specific in some areas. We add iHeard Colorado Pueblo. That is the one where they're able to identify that it's coming from Pueblo, and it's information that's that I put together to share with everybody that comes from the organization here. I email out at least once a week to about 30 people out of my 100 that I have on email. I announce at committee meetings and start a dialogue. And this to me is a way for us to get the information out to the community. I'm so honored to be a part of what's going on with this organization. I'm trying to get additional resources to bring to bear. I think that if we could expand in reference to maybe making television commercials and getting out there more than just what we're doing now, I think would add, because we have to counter a lot of this negative, I call it propaganda that's being put out in reference to our community. So the biggest thing I want to share with you is this how it comes home to me. As you see here, there's Benadryl. My wife has been taking Benadryl for quite a while, and when I seen this poster here, I was kind of like shocked. I gave her a copy, and she looks at it and she says, "I don't care. I'm going to still take it because it works for me." So even though you educate people, sometimes they're headstrong. So I tried, but this one hit home real hard. So yeah, be aware that even within your own family, you're going to have some resistance of what you're trying to do. So yeah, with that, ends my presentation. Yeah.
Okay, thank you, George. So as I had mentioned before, we are now in essentially a no-cost extension for our work. So now we have funding through the end of September, and we have, based off of lessons learned over the pilot phase, we still technically are in a pilot. And so we're making some changes, such as we've increased compensation for surveys to $10 a survey, but we are also reducing the frequency of those the payment distributions. So we're seeing how that goes. We are continuing, we're re-recruiting now. Our goal is to get 200 people continually to complete the surveys. And so we've just made some little tweaks here and there, also revising the roles of community connectors and recruiters, hiring folks specifically as recruiters rather than overtaxing community connectors, and continuing the work with trusted messengers, trying to find some organizational partners who can amplify our message as well. So those are kind of our main next steps, and to be determined after September, but that is pretty much it. I realized I did not put our main website, so I'll plop that in the chat. But without any further ado, questions?
Thank you to both Meredith and George for the presentation. We are now open to the Q&A session. So depending upon your comfort level, if you'd like to come off of mute and ask the question, and or you can put your question in the chat and I can read it. Thank you, Meredith, for putting that. I do have an initial question to get things started, and that is related to interpretation of the data, as far as when after things are pushed out in visual formats, and your community connectors, but also your trusted messengers push it out as well. How do you know that people are going to understand the information that's pushed out, and how is it used?
So I can't specifically speak to understanding it. However, it's the weekly assets, like the social media blurbs, that are pushed out to the communities, where that's where we're asking trusted messengers to post the social media. And it's pretty, it's just like 1 or 2 sentences. So we're not pushing out those long newsletters to more of like the community level, the community member level. That's more for the trusted messengers to distill if they prefer, or just share out those little snippets. Some great examples, though, is we've had, one was a post about food banks and accessing Meals on Wheels. And one of our trusted messengers had posted about it, and we had included the local Meals on Wheels number. And there were some posts saying, "Oh, thank you. Now, I didn't have this information. I'd like this, to use this service." And another post about a trusted messenger sharing her personal story. It was about breast cancer screening. And along with her post, she had shared saying, "I'm a survivor. I had an early screening and I found something. And, I just want to share my experience along with this information and PSA basically." And there were a lot of people saying, "Oh, thank you, great suggestion." And so people in this, that's one great thing with our trusted messengers is they can both localize it to themselves and their community resources.
Thank you. I appreciate that. So in the chat, we have a question from Sydney. She said she's really appreciative of sharing your efforts, and she lives in a rural county and would love to dispel some of the misinformation that's going around in her rural county. What plans do you have to expand this initiative throughout Colorado?
At this current time, we don't have anything set for expansion. As I'm sure many of you all know, it depends on funding and all of that. But I mean, if you are in the San Luis Valley or that part of the area, please let me know, and I'd be happy to share some more information. But right now we are more just in our pilot phase. We're confined to Denver, Pueblo, and San Luis Valley. But that doesn't mean that you can't subscribe to our newsletter and share that.
I'm sorry if I missed this as well. How do you identify the issue areas or the topics that are surveyed?
So that is a great question. That is also basically the St. Louis is the one that does kind of news environmental scans across the nation, and then they actually do scans for Colorado. Sorry, my hands are disappearing. And so they are the ones that lead those identifications, but then we also have the opportunity if we hear like, oh, hey, there's this buzz going around in Denver. Can you add this to the survey? But in general, it's St. Louis that leads that determination.
And if there is like buzz, like if I like reached out and was, like curious about a certain issue area, I'm thinking about things that are a little bit more polarizing, maybe, just thinking about the upcoming election, just, gun regulation or abortion policies. So kind of gauging like how communities are feeling about that would be really interesting.
Yeah, they try to stick mostly to health related things. So I don't think the election would be included, but we have actually had some gun violence questions because that is a public health issue. So those questions have been asked, and sometimes St. Louis, there are other sites throughout the country. There's two or three other active iHeard sites, and so there are weeks where Colorado will have a subset of questions where, Baltimore might not. So they are able to add those additional weekly questions. And I do want to mention that questions are often repeated over time to see if there's a change in what people are hearing and their responses. But then some questions are just kind of a one-time, like, did you hear this about tobacco regulation or something?
Great. Thank you for your presentation. That was really interesting. Thanks.
Thank you. Thanks for coming.
Thank you, Meredith. And Melody, thank you for asking that question because that was one of mine as well. So to George, I'm wondering in your personal connections when you're talking to your voter registration group and other groups that you're discussing with, how do people respond to the information that you're presenting upon and talking about?
They're very surprised. I was like myself, a lot of that information was coming out that I didn't know about, and they like it because they're learning new things about what's going on with health, especially the whole thing with COVID and how what that took place there, how we did everything backwards. Now that we're proactive, they like to, they want to know. People want to know what's going on, and especially the families with a lot of kids. They are the ones that are most interested with like with LULAC and the GI Forum with the Veterans Organization. A lot of them are very because the newspaper down here in Pueblo, as you know, isn't really that good. So any information we could get to them, they love it. And it makes me the center of attention because they think I'm a professional in the field, and all I am is just a messenger. And I really enjoy sharing that information and empowering our community so that they can be proactive. And then they end up acting like they're the professionals, telling everybody else, hey, this is what you got to be doing to protect yourself. So yeah, I get a really good response. People are very surprised, but they're very excited about knowing about this information, and they're hungry for it. I'm really impressed that our community is trying to be proactive. And like I shared with you before, in Pueblo, for COVID, we had the worst immunization for Latinos, the highest COVID count, and the proportionate wise compared to the rest of the state, and the highest death count. So Pueblo is a real case study, and that's why I think people want to be more proactive down here. I really think so.
And George, I would not say just a messenger.
Yeah, well, yeah. I get involved with all these community organizations, and I love it because being involved, for me, it's a way to keep in contact with the community, but also when things do happen, like voter registration or what we're dealing with, iHeard, or any other things. I was involved with another one sharing information on the on COVID, and I love doing it. It's just it's very therapeutic for me, and it's very empowering. And I'm so honored to be a part of this group. I really am.
Well, thank you. To Meredith and George, thank you all so much for presenting upon this work. It really is pretty darn cool, and I love that it's so near real time. I want to thank all of our attendees as well for attending this session. We are ending a little bit earlier, but also I want to thank you for your participation in the Q&A. Before you head off, just a few short announcements. All the slides and additional handouts that might be related to this presentation are available on Sketch.
Your audio bliss.
Your audio went out.
It cut out after the slides are available on Sketch.
They're available on Sketch. I'm trying to remember your talking points. Hold on. They're available on Sketch, and after the end of this conference, everybody will be provided with a survey link for how they felt the conference went. Please complete that if you can. The completed surveys will be put into a raffle for two $50 gift cards. So there will be two winners, $50 gift card each. And am I missing anything else?
Can you hear me now or not?
Yeah, actually.
Oh my
Got
gosh,
you.
sorry y'all. I don't know what happens. This is like the beauty of virtual conferences. You did great, Taylor. Thank you for filling in. After this, there's going to be a bit of a break. You'll have about between 15 to 30 minutes before the next concurrent session starts up again, which that session will begin about 1:30 p.m. And there will be 3 sessions to choose from at that point. And you're welcome to check out the full schedule on Sketch and that's the Sketch conference website. Again, thank you all very, very much. And we look forward to seeing you in just a bit.
Thank you, everybody.
Bye.